day viewers, Namaste, Namaskar and Vanakkam. This is a video series aimed at Indian migrants, and through this video series we are aiming to achieve two things. One is make you learn, meaning learning new facts, new information about sexuality, and also make you unlearn some long held opinions and thoughts about sexuality. So bringing learning and unlearning together, we aim to improve your sexual health literacy.
This topic is about sexually transmitted infections, or also known as STIs. So what is an STI? So sexually transmitted infection is an infection caused either by bacteria, viruses, or other microorganisms that transmit generally through having sex with someone. And these infections can present on your genitals or anal sites, sometimes also on other sites of the body. STIs are very common, especially in young population from 15 to 29 years of age. And STIs can happen to anyone. So if you are having sex without condoms, unprotected sex, or if you have multiple partners, you're at risk of getting sexually transmitted infections. And that is why everyone in the community, especially young people, need to be aware about STIs. So what are some of the symptoms of STIs? Common symptoms of STIs include lumps and bumps in genital area, ulcerations or sores in the genital area, but also discharge coming through either the penis in a man or a vaginal discharge which is changed in a woman. So these are common symptoms. But people obviously also have oral sex, so some of these symptoms can also present in the mouth. Common areas such as penis, scrotal area, anal area, these are the common areas for symptoms of STIs. What are the common STIs? Common STIs include bacterial infections such as chlamydia, which is one of the most common STIs in Australia. Also gonorrhea is becoming more common nowadays. Other infections such as herpes or genital warts caused by a virus called human papillomavirus are also seen, although they are declining in number because of vaccination for HPV. The other STI, which is an important STI to know, is syphilis. And syphilis causes ulceration or rash on the body. So how can you prevent getting STIs? One of the important ways to prevent getting STIs is to use a condom when you're having sex with casual partners. Other way obviously is to have a regular partner who is uninfected and tested. It's important to prevent STIs, but also to make sure that you don't have STIs, to get a regular checkup. So when you are starting a new relationship, please go to the general practitioner in your area or a sexual health clinic to go for a checkup. And if you know that you have STIs, it's easy to get rid of them. The other ways to prevent STIs would be to get vaccinations for those STIs where vaccine exists, such as human papillomavirus. You can get vaccinations for those STIs and prevent those STIs as well. So where can you go for STI testing or getting treated for STIs? STI tests are very easy to do. They are available at your local GP, so that is your first port of call. But if you are not able to go to your local GP, then there are clinics across the major cities in Australia, especially in Sydney. They are called sexual health clinics, and these clinics exist in every part of Sydney. You can go there either with an appointment or even without an appointment. It is important to know that you do not require Medicare card or any fees for getting to a sexual health clinic which are publicly funded. If you go to a GP, obviously the GPs will have their own fees that you will need to pay. These are two common places. Apart from that, you can go to family planning centers and get tested there. And there are some other special youth clinics where also you can get tested for STIs.